Why more brickbats than bouquets in running a hospital? For this discussion, we are joined by, and please welcome, Dr. Atul Kapoor, Managing Director, Regency Healthcare, Dr. Shuchin Bajaj, Founder and Director, Ujala Cygnus Hospital, and Dr. Mayank Somani, Managing Director and CEO of Apollomedics Super Speciality Hospitals, Lucknow. Welcome to this discussion, gentlemen. Thank you so much for being with us at in the Gratitude Week. It's great to have you with us. Mr. Bajaj, let me start with you. You have been running hospitals now. What is your experience in running the hospitals? Do you get more of gratitude and thanks, or do you get more of brickbats?
Thank you very much, Anisha. It's good to see you again. And namaskar, Dr. Kapoor. Hello, sir. How are you? Good to see you again. So thank you once again for having us on board this Gratitude Week. Lovely concept, and it's drawing to a close today. So it's a bit of a mixed emotions for us, happy and sad, as happens in all hospitals, I think. We've been running hospitals in small towns of North India for the last 8-9 years now, and see, the mismatch between expectations and delivery is more pronounced when a person or a patient has to pay from his or her own pocket. That is the big gap between the expected outcomes and the real outcomes. The patient really feels that he or she should not be made to pay for any medical services. That is ingrained in the mind of everybody, that medical services have to be charitable. Doctors are supposed not to, ask for any money. And if there is any money being asked, that for sure means that there is some cheating going on and somebody is fleecing somebody if there is any exchange of money. And once I have given some money, then of course I have to be very sure that there has to be no adverse outcome. It cannot be that I paid 50,000 rupees and then the doctor tells me that, oh, I'm sorry, we could really cure you of your illness. So the more we move towards a model where the patient does not have to pay out of pocket, I think the lesser these brickbats will become. Of course, there are a lot of bouquets in this whole venture. Otherwise, we would not be doing it. I would not have left Delhi and gone to these small towns if there were no bouquets. There are a lot of bouquets, of course, because we provide services which are not existent in those small towns. We are the only ones who are providing these services. And as you know, we are the largest provider of Ayushman services as an organization. Ayushman itself is a wonderful scheme because there is no out-of-pocket expense involved. There is a lot of stress on quality, lot of stress on accountability. You can't have low quality services or unaccountable services in Ayushman models. That is where we get a lot of bouquets, not just from the patients, but from the policymakers as well, from the lawmakers as well, from other organizations as well. But I think the brickbats are only few and far between, and the bouquets more than compensate for those. On a daily basis, we get a lot of pleasure, a lot of happiness from treating our patients. One particular incident that I can tell you about was when this whole COVID pandemic hit us hard and our OPDs fell drastically. We started a telemedicine solution for our patients. And last month, we made more than 35,000 teleconsultations. And all of our patients were so thankful to us, saying that this is a wonderful model. We were wondering how we will go to the hospital, how we will talk to our doctors. Our blood sugars are not controlled. And every telemedicine consult that we did, and it was not just in our own geographies, we did telemedicine consults as far as Bombay, as far as Chennai, Africa, the US, and we got a lot of bouquets on Twitter as well for that people were very appreciative that we were reaching out to such a large geography. So it's a mix of both, of course, Anisha, but the bouquet is far, far more than the brickbats.
Dr. Atul Kapoor, what has been your experience? Dr. Bajaj just told us that it's a mix, and he really appreciates the good words that his patients have to give to doctors who have treated many of the patients. How do you see this entire situation? Do you see the glass half full or half empty?
See, Anisha, it's a mixed bag of things, you know. He said that Dr. Bajaj said that we have Bouquets and Brickbats both. See, the problem is that now I'm running this industry for the last 25 to 27 years, 27 years to be in fact. And we have 6 facilities now, 5 in Kanpur, 1 in Lucknow. Going forward, the biggest problem what Dr. Bajaj analyzed was the payment part. The patient has to pay from his pocket. So nobody wants to pay for a health service. People want to pay for big fat marriages. They'll pay for big fat jewelry. They'll pay for anything. They want to have big cars, but they don't want to pay for health. And that's across. The people who have big cars will come to you for a discount. That is where you start laughing. That this guy can afford 10 Mercedes cars, but he'll come for a discount because he feels pleasure in that the doctor should be working for free or for lesser amount. See, understand that as an industry, even the government at times sometimes says that no, we are overcharging, he's overcharging and she's overcharging, and they are looting the public. The media will come out that we're looting the public and we are charging high for implants and all those things. Understand, where does it come from? First of all, we have a debt to service. The loans that we take has to be repaid back to the banks. The huge debt service, a huge capex, as well as all the doctors will agree with me. There's a huge talent cost. If you have a good doctors, you need to pay them high. People equate a doctor of a government service, let's say, who's getting 1 lakh of a salary, but our intervention radiologist will be getting about 10 lakhs. See, the talent cost is huge. And how does that money come back to the system? You're running a company to make some money, or let's say service the debt, or service the society and make something in the bottom line. Investors are there. Then, government gives no relief, no tax relief. You pay tax like ordinary people. There's no GST relief. We keep on, all of us will understand huge amount of GST that we are paying to the government. We get no input whatsoever because health is not taxable. So even if it was taxable 1% GST, at least I would recover crores and crores of rupees, the GST that we pay to also, housekeeping staff, security, machinery. So now see, we are caught in 2 angles. First of all, a huge debt, a huge capex. Investors working with us, they want a certain EBITDA. We have to work on that direction also. Cost has to be taken care of. Plus the, let us say the talent cost. Combined together, the cost of treatment has to be not at a government level. People have to pay for it. Ultimately, and when you want something good, you pay for it. You go to the best resort in the world, you spend 50,000 rupees for a room. So, because you want it. Here, people think, in fact, Dr. Dharmendra Nagar also said just now, that out of majburi, it is a majburi. And they don't want to pay for a majburi. Health is not majburi. Health is everything that a person can, basically have. The best health is the best what a person can have. So seeing going forward, the bouquets come from all kinds. For example, in the world, 8 police people shot by an outlaw. 7 of them injured with gunshot injuries all over their abdomen were admitted in my hospital. So in Kanpur. So we treated them. They're all absolutely fine. They'll be discharged in 3-4 days' time. So that gives us happiness that, and government was also appreciative at that point of time when when the CM came to visit the hospital and all the ADGs and everybody and DGPs and all. So they were praising us that, did a great job. You saved my policeman. So those are the bouquets you get, and bouquets you get from every single angle. Any patient who goes well gives us bouquets. But brickbats come only primarily because of the financial cost that patient has to pay. And the cost obviously is derived from the cost that we have to incur to maintain that setup.
Right. Dr. Somani, both our previous speakers have underlined the fact that people are complaining because they are unwillingly having to pay for medical services. But even those who go to public hospitals complain. They're not paying, but they complain. It's dirty. Doctor doesn't see me. Their list is also very long. So what's the problem? You criticize the private service providers, you criticize the public service providers. Are Indian patients not possible to please at all?
Yes, Anisha, Dr. Kapoor, Dr. Bajaj. See, I'll answer your question that, people, their expectations of the services versus what is being delivered, that gap is significant both at public as well as private. So that is what that gap, if it can be filled in their own minds or the service provider fills that, that's the only two ways it can be handled. So that's where you go to a public sector hospital and people are still complaining because they think that if they have brought their patient, they should get adequately treated. And the definition of that adequate is always a question mark. We don't know what's their expectation. So the expectations have to be set right before we are able to, so the satisfaction quotient will be defined eventually once we define what's the right expectation. And that's applicable both in private as well as in public. And Anisha, just quickly, I was told by Kamal to present, to share the thoughts through a slideshow. So let me know,
Yes, please go ahead, Dr. Somani.
No,
please.
but I don't want to take the time of everybody else. So I was prepared with a slideshow, and Kamal said that this is the last part where there will be an interactive session. But if you want to go ahead with the interactive, I'm also okay with that. The choice is yours, but there is.
All right, Dr. Somani, then let's just have a discussion first, and then we'll go through your presentation once everybody has.
That's only on the Brickbats and Bouquet and the concept behind that. So let me know, but otherwise we are happy to just interact as well.
Sure. Dr. Bajaj, you spoke about the Ayushman Bharat scheme. Because of insurance coverage, criticism is lower. Is this then the way out? Because you may give insurance cover, people may or may not pay their premium, the company may pay or somebody else may pay, or you may pay out of your pocket. But if your infrastructure is not going to be enough to meet the needs of the large population, will the criticism go away?
Say it again.
Very good. Sorry.
Okay.
Dr. Bajaj, the question.
All right.
Yeah. So that's a very important point that you've raised, Anisha, and it ties back to the last point that you had raised, that it's not just the private hospitals that are facing criticism, it's also the public hospitals where actually there is no out-of-pocket payment involved, but still there is a lot of criticism happening. So there is obviously no one magic bullet for everything. You can't just say that, okay, if the payment goes away, then everything will be hunky-dory, because we have to understand what is the issue with the public hospitals. It's not the quality of services, I feel. We've all been trained in public hospitals. I think the quality of service there, the quality of doctors there is far superior maybe to most private hospitals, not just... but the problem is that there is no communication. The associated staff does not take care of the patients as they are meant to, I think. If you go to a private hospital, the nurses and the general duty assistants would be doing almost 95% of the work. Whereas in a public hospital, all that work will be done by the doctors themselves. And thus they have no time to communicate, to walk the patient through the journey, to make them understand what exactly is going on. And this opacity in the entire transaction makes the patient uncomfortable, makes the patient doubt the intentions of the doctors. And when an adverse event unfortunately happens, the reaction of the patients is generally that we were never told about this, we were never told that our patient is serious, and how did the patient just suddenly die, and now you're coming and telling us the patient is no more. And that is when all hell breaks loose. So this communication is also needed. So we need to have a system where the quality and the work ethics of the private hospitals are transferred into a system where there is no out-of-pocket payment. universal insurance is a good way to do it, but we know that that is also not the real solution, because if you have only insurance, then still the incentives of the doctor and the patient stay misaligned, right? If you have an insurance, the incentives of Dr. Kapoor and myself and organizations like ours, Dr. Mayank's organization, is that you fall sick, you have a heart attack, you come to our organization, we'll put a stent into you and we'll charge money from the government or the insurance payer, and you'll be fine, you don't need to pay, but still you've had a heart attack, right? There is no incentive for you for us to counsel you not to have that heart attack. So the real solution lies a long way ahead. We need a paradigm shift in the entire healthcare ecosystem where there is no payment at the point of care. If there is no exchange of money at the point of care, you can never doubt the intentions of the doctor, right? Because right now you go to hell if you do, and you go to hell if you don't. So things like cardiology and obstetrics are the most affected by this. You do a cesarean, patient says you did it because you wanted the surgery money. You don't do it and something happens to the baby, then you're stuck, because the patient will be like, doctor raat ko aaye nahi aur dekho ab ye bacche ko hamare ye sab ho gaya. Same with cardiology. You put in a stent, तो patient is like, अरे जबरदस्ती डाल दिया, कुछ था ही नहीं, गैस की शिकायत थी और इन्होंने तो देखो stent डाल दिया, इनके पास गए, and you don't do it and something happens to the patient, you are stuck again, that patient complicate हो गया, he is having CPR going on because you didn't put in the stent in time. So if there is no point of exchange payment there, that you are not paid for per stent, or you rather paid for an outcome based, that how many in the district are healthy, or how many of your patients circle that has been coming to you are healthier, I think then the patient will not doubt it, right? Because you're not being paid for the stent, you're being paid for the patient outcome, that the patient is healthy, the patient survives, the death rate goes down, or all these things. So it is a long way away, but I think universal insurance is something that we should definitely start out with. It should be compulsory. If you can afford to have insurance for a scooter or a motorcycle or a car before you get onto it and drive out into the city, I think you should definitely be made to be responsible for your own life. It is much more expensive than a scooter or a car that you buy your insurance for. So personal health insurance, I think, has to be a compulsory thing for each and every citizen. And of course, you can top it up as much as you want to put in all the bells and whistles that you need later.
Right. Dr. Somani, as Ms. Bajaj said, that insurance is a good way out to reduce the angst. But I'm still trying to understand, why has this perception come about that private hospitals are profiteering at the cost of the health of people? Now, we heard Dr. Atul talk about the cost private hospitals have to incur to run their hospitals and give the service that they do. So they have to recover the cost. But everybody just says, oh, they got free government land, and look at the amount of money that they're taking from patients. This is exploitation. Where has this belief come from? If it really wasn't the minimum costs required for payment, why do people feel that there is exploitation?
Right. Anisha, what I'll do is I'll quickly put on the slides, and it has all the answers which you are seeking, and it has a base to it as well. So I'll quickly do that. And then can you see the slides?
Yes, I can see them.
Yeah, so that's how, I'll quickly, so this is just what I was told to, so, and just, I'll quickly take 10 minutes and I'll rush through it, because now the premise of the whole conversation is interactive rather than a presentation. And I would not like to take too much time of Dr. Bajaj and Dr. Kapoor, so I'll rush through it as well. If you look at the journey of a doctor, at 12th class, what do you think is the mental ability or aspiration of a 12th standard guy, 17, 18 years of age? What are we expecting? Is he looking at a philanthropic life? This is the answer to your question. That once somebody decides at the point of 12th class that he's going to become a doctor, he's not looking at a philanthropic life, which everybody's expecting him to deliver because he's not supposed to charge anything. Are you with me with this?
Yes, definitely.
This is no, the aspiration is largely that you have a concept that there will be a financial stability in life and you will get some respect. And that's why a person becomes a doctor. Then you do graduation, post-graduation, specialization, super specialization, and more super specialization. Take 18 to 20 years to become a doctor. And what are you looking at? Respect, finance, peace of mind. And look at these two guys, they're top, and they didn't study as much as any doctor, a regular doctor reads. And look at them where they have become. What have they become? The amount of respect, the amount of money, the amount of stability in life. And anybody can recognize these guys. And even if the smaller photographs, if you look at, even a very small Nadella, somebody who's just at the bottom of what he would become is also very happy and satisfied, content that, okay, he works, he gets respect, and then there's a stability in life. But what a doctor, after 20 years of hard work and with few lakhs of earning, is labeled as in today's times thief. Everybody thinks that a doctor is stealing. Conceptually, we are defeated already. Now look at the whole premise. India spends 1.2% of the GDP on healthcare, which is lowest in the world. Heavy disease burden, and health expenditure per person is also the lowest. Public versus private healthcare. Now this is the paradox here. If you see, public healthcare, both rural, urban, is lesser than private healthcare, and also the amount of money spent is also more on private healthcare. And why is that? I mean, who's forcing anybody to come to the private healthcare? Private healthcare or people charging will die on its own. If everybody goes to public healthcare, don't bother about private. If there's no demand, there's no supply. So what is it? Why is the paradox? Because there is no nearby complete facility. People like Dr. Bajaj, Dr. Kapoor have created brilliant facilities for people who needed it, And then there is inconvenient facility timings. People are not available at night. There's healthcare personnel availability is a big question mark. You may not get the doctor you desire. Then there are the long waiting times, and the quality of care is question mark. Now, what's happening? We are the number one healthcare provider exporters, Doctors and nurses go out, they don't stay here. Why again? I mean, if there's a great infrastructure, if a doctor is supposedly to be noble, then treat them like one, make their lives easier, keep them here. Why are they even going out? And that's my personal journey. I've done, been largely into academics, and then I thought that I'll create a hospital. Why? And Kamal specifically asked me, you created a hospital, and why do you feel that there are more Brickbats or Bouquets or vice versa? So this is the answer. There's a family perspective to it. There's a risk aversion. Don't take the risk. You're happy, you're educated, you're stable. Why do you even do it? So if it ain't broken, why fix it? Was the question which my family asked. And then and Dr. Kapoor just mentioned, that there is an investment, then there is a design and build. You build the hospital, then there is a clear infrastructure, and then there is an approval matrix which you have to go through. And all of that is a difficult proposition. It's not easy. So, there's an expectation reality mismatch from the investors. There's a reluctant local institutional investors. And there's a completely convoluted healthcare finance medium. They don't understand that it's a capital intensive, long gestation. And then you get a land, and then there's land mafia, sand mafia you get into. Then there's an infrastructure to establish, which takes its own time. And then there is an approval matrix where approval to start the hospital, approval to run the hospital. There's so many challenges. And then you end up running the hospital. And then what happens is suddenly, private healthcare is already deemed expensive. It's labeled already in the whole mindset because nobody wants to spend money on health. You can go to a 5-star, you can go to you can go to Hawaii, but as soon as you have to spend 600 rupees for a consult, you have a problem. So this is the mindset which has to change, if at all. And then there's a zero tolerance for untoward outcomes. You're paying. Once you've paid, that means you've bought life. No, that's not possible. We are not gods. So somebody needs to understand this. And then there's a gross unacceptability of cost overruns. We're not making a room. We're treating a patient. We seriously have no clue. We give an estimate, I can remove your gallbladder. Suppose it's complicated, there would be a cost overrun. But people are not accepting it at all. We can't really always guesstimate right. And then resorting to violence is such a common. Making a bill is like a crime. I mean, you treat, you're fine. You make a bill, oh man, you're a criminal. So what do you do with this mindset? Asking for money is evil because you are noble. And I'll come to this noble part again. So, and then this is the part where you're running the hospital, and from the perspective of the patients, then you have a staff and team pressure as well. Running the finances or the regular day-to-day. Here there is investor expectation. There's a family expectation as well. They are also on your head that you don't give us enough time. And then there's self-expectation. I want to do something else, but I couldn't. So, you always are under pressure. And then media. Typecasting is such a common practice, a perpetual fall guy. Don't even listen to doctor's perspective. As soon as somebody complains that we did not get the right deal, you are in trouble. So there's a biased narrative for sensationalism, so-called TRP. And if you look at violence against doctors, 75% of doctors in India have faced violence at some point of time. And it's everywhere, wards, OPD, emergency, everywhere. So what are the key triggers? Long wait for appointment, investigations, overcrowding, delay in patient care, but largely these are just triggers. They want an opportunity to just shout because they are spending money. So why is it? What's the concept? And that's something which is ingrained in all of us. Like, doctors are not supposed to charge money. And that's the basic concept. And that's where your answer to your question is, that why is it even happening? It's happening because everybody is very clear that we do not want to pay. And and the concept that doctors it's a noble profession, it's a philanthropic profession. Everybody who's getting into it should not charge, should not take money, and just continue with the philanthropy. And then there's a fragile because I'll just skip that. And the fear which is palpable. Doctors feel stressed in their profession, are scared and hiring security. So what would doctors submit? Have faith and take an unfiltered narrative. Understand from us as well that where are we coming from? And Dr. Kapoor very clearly mentioned, there's so much expectation. We need to bridge that gap of understanding that why people are even paying. And doctors don't make a huge amount of money. Please be, most people think that once you're a doctor, you're making money. You're not. Look at the IT industry and various other industries where people are really, and this is again the same. And are we leaving behind a legacy? It's a dark chapter now. I don't think that, most people are shying away from becoming a doctor. My own daughter, I have one daughter, and now she is doing her computer science in Berkeley. We both her parents are doctors. There's just so much of overlay, so much of influence which was possible, but the influence was negative. Now, a lot of people ask me this, so you don't think that there's any gratitude? There is nothing? No. The case is that we get 98% of the times gratitude, lots of it. And I'm very happy, and that's what keeps me going as well. And most doctors, and Dr. Kapoor and Dr. Bajaj and everybody else, whoever is there. Why? Because see, what happens is that we get it daily, on a daily basis. There's a daily dose of gratitude coming. And then there's a 2% people who are dissatisfied and cause disharmony, discontentment, anger, violence. But trust me, that 98% of gratitude which I get gives me only 2% of my life, because one media, exposure, so-called exposure or coverage, it kills my 3 months of life. There's a media, there's a paper, there are people shouting, there are videos, there are social media, and everybody is grabbing only the headlines. I do a very difficult neurosurgery. I get hardly, 1 or 2 likes on my Facebook. And somebody else puts that so-and-so hospital, there's a violence, you get 1 lakh likes already. So why? Why is it like that? So the whole concept, it's not that, we don't get, we're very happy with the work which we do. Unfortunately, it only becomes 2% of our life. The 98% of the times, I'm just managing people's discontentment and dissatisfaction. 1% out of the 500 OPDs start shouting in the OPD. I'm managing him for next 5 hours, not attending the OPD only. So the doctor is the labeled noble guy, and everybody else is the self-proclaimed judge who tells how a doctor has to behave. And that's where the whole problem is. And this whole nobility is great. I mean, I'm very happy to, very happy to make people understand, or anybody, if you think it's noble, then everybody should come together and make everybody feel noble as well, right? Like, for example, an army personnel has his own whole life chalked out. Or a doctor doesn't. If you tell me that my life will be chalked out forever, I get all these facilities, everything, then it's sought after. But we have to make first we have to make our own education, then we have to make our own lives, we have to make our own clinic. We don't get any support from the government. It's not that I'm paying commercial rent for the place, I'm paying commercial rent for the electricity, water, everything. So why is it that even expected that there will not be a certain cost, and the cost control is there, but there's a mismatch in people's expectation versus the cost. And Anisha, I can read at your face that have gone longer than what you wanted, but where, the whole concept has to be understood as to what is it, what's wrong with us,
I think what is wrong with us is that all of us have become so materialistic that whatever is deemed free, our health, our good health, the air we breathe, all these, because they're free, they're worthless. This is the problem. Nobody realizes the value of their health till they fall sick. But, it was free. And then they had to pay money, and then all the discomfort started. Dr. Kapoor, we heard Mr. Somani gave us an entire snapshot of, how somebody goes through setting up a private hospital, and, what is the urge and what is their motivation, and then what really happens. In our country, there is a huge demand-supply gap in healthcare facilities, healthcare infrastructure. The government is very slow, but because there is a market, private people are coming up, private hospitals are coming up. Do you see this as an ongoing opportunity, or do you think that there will be a little hesitation in setting up private hospitals if this is the feedback that you get, if these are the day-to-day problems you're going to face? Dr. Kapoor, will request you to please unmute yourself. You're on mute now.
Just a moment.
Yes.
Fine?
Yes.
Anisha, sorry. Well, things have changed in the last 4 months, 5 months, to be honest. And the healthcare industry has gone to, troubled times, primarily because the huge CapEx cost and the huge salaries had to be taken care of in corona times, and the business was hardly 15%. Now, this 4 months has given a deep stress to the entire industry all over the country. I'm very sure about it. So all the healthcare providers now are on a common platform for the thought process. For next 1 or 2 years or 3 years, I don't think that anybody would like to invest in healthcare, keeping in mind the stress that has gone through in the last 4 months, and keeping in mind that the loss of revenue plus the expenditure is, ultimately I tell you that normally in any good hospital, about in a good corporate hospital, the salaries component is about 47 to 46% in a good hospital of the whole revenue. Now understand that when I get 15% of the revenue, how can I pay 40% or 47% of salaries? But again, because we are here for the last 25, 26, 7 years, we continue to do that. Plus all the government regulations of COVID, providing all kinds of protection to the doctors, to the people, and to the staff, like PPE, and creating huge isolation tents. We have created huge isolation tents of 5,000 square feet where social distancing is being practiced because hospitals don't have that much space what the government wants. Now, all that cost huge to all of us. And then after that, All kinds of controls are there now. You can't charge this much, you can't charge this much for the ICU, you can't charge this much. You expect the doctors to work in COVID times, put their health to risk, and then again not charge also. So then they can live their lives because they're noble people. They can give their lives also and not charge anything. Now there the government steps in. No, there's a market cap, there's a price cap. Although honestly speaking, in UP at least I know that the government has done 90% of the COVID work and private sector has hardly done 5 or 10%. Fortunately, for us, they have not pressurized us. They talked to us that we should create a COVID facility and we should do something more for that. The pressure comes not from me or not from any doctor, not from the public. Pressure comes from the VIPs in the system. Our so-called, let us say, the rich people of the city, or maybe the politicians as well as the senior officers. That God forsaken, if something happened to them, where do they go? So Dr. Kapoor creates something of this kind. You must have, because you're the leader. Fine, all right. But where do I get the doctors to work on that? Again, I have to insure them also. See, a simple insurance for a particular person in private sector for 50 lakh, let's say, who works in COVID facility, Dr. Bajaj would know, and I think Mayank also knows. It's a huge cost. How can I risk my people who are working in the last so many years to go through a COVID facility and then not charge for it also? So what do I do? And again, if God forsaken some patients found positive, the whole system will hound on the patient. They'll make him feel like a criminal instead of empathy and sympathy that you have a COVID, you get all right, don't worry. The whole system, the police and the medical departments, 5 ambulances and so many people will take you away and they'll carry you away as your criminal, and then the family is taken away. That all has deterred the private sector to come forward for COVID facility treatment. Why? Because all of my doctors say that, look, if something happens and something does happen to me, what happens to my family? Nobody's worried on that point that what happens to their family. So ultimately, Mayank said the same thing, Dr. Bajaj has the same view, that the cost, the people have to understand there's a cost, they have to pay for it. No system in the world is where it is free. Believe me, Ayushman is doing good work, all right. But anywhere in US also, something comes from the pocket. And unless a patient spends something from his pocket, he does not value the treatment. Believe me, you hold a free camp anywhere, he pays nothing for it. But paper is you'll throw in the dustbin. But if he pays even 50 rupees, 40 rupees, 25 rupees of registration, he'll keep that paper properly. So everything free is also not possible. You have to mix. Government can do much more. And if the government does do much more, I'm sure there'll be less scope for private sector. But then the gap is huge. Mayank said just now 28% and 72%. Those figures even I didn't know. I thought it was about 70-30. But anyway, closely, if the places where there are government setups, let's say Lucknow. Lucknow's got good government setups. SGPGI is there, KGMC is there, doing good treatment. So scope for private sector is limited there because they are doing a lot of high-end treatment for which we also look up to them to get professionals from those institutes. But in smaller places, believe me, there's a wide gap. And that is why entire 2 and 3 cities, the private sector has a great future as compared to metros where they're only overcrowded. But people have to pay.
Right. Dr. Bajaj, I've been a news reporter and I have seen that for healthcare listed hospitals, investors line up to buy stake. If there is a problem, if stake is available, whatever be the reason, they line up because they believe there is a market, an untapped market. And if Indians are not paying, there are many foreigners who come to Indian hospitals to get treated. They do pay, right? So where will that thrust come from? Investors seem willing, despite the day-to-day challenges hospitals face themselves. Will they be pushing forward just because of the size of the market and getting more people? Just by setting up new private hospitals, will we solve the problem? Where will we get the manpower from? Because there are only as many doctors. What is going to, like Dr. Kapoor said, that there may be some hesitation because the last 4 months have been tough. But, for a long-term player who's looking at 5-10 years, what will be the thrust? Will it be a private person's personal aspiration to serve the society? Will it be investors who see good returns because, there is an unmet demand? What will bring the thrust for, the private system to go forward from here? Because the Brickbats are many.
Yeah, so investors are definitely interested because they see the wide gap inavailability that Dr. Kapoor was also telling us about. There are only a very few cities where the public sector stands up and gets counted amongst the best hospitals of the city. Most of the other places, the budget of the public facilities are 10 to 100x of what the budgets of those private hospitals are. But as Dr. Somani pointed out, 80% of the facilities are being provided by the private players. You travel across North India, town to town, city to city, you'll see every city has the same situation. You'll find a large civil hospital spread across acres of land, and the budgets of that hospital will be running into hundreds of crores of rupees a year. The salaries of doctors and staff will be much higher than what the private players are affording. And after 2 o'clock, I don't think you'll find even a single soul there. There you'll find just one doctor sitting in the emergency, referring patients to the nearest big city continuously, refer to Lucknow, refer to Chandigarh, refer to Delhi. That is all is being done there. It's a very sad state of affairs. And we have this misconception in our mind that everything is free. It's nothing is free, right? As Dr. Kapoor said, nothing is free anywhere in the world. So the public healthcare system is paid. It's like a prepaid system. It's paid upfront by the taxes that all of us pay.
Right.
And the per bed cost, if you can work out. So we did a lot of exercises with the Delhi government, just trying to analyze what exactly is the average cost per bed in a government hospital. So most of the private hospitals that you see, their average revenue per occupied beds would be ranging from 10,000 to a very small center that is running in a small town to say 30, 35,000 in a big center, or in a multi-speciality center that Dr. Mayank or Dr. Kapoor may be running. It's unimaginable what is the cost per bed in a Delhi government or a state government hospital. It runs to almost 80,000 rupees per bed if you include all the costs. So we are paying taxes to run those hospitals at 80,000 rupees per bed. The private sector is charging 15,000 or 10,000 or 20,000, and still we feel that private hospitals are more expensive. Whereas in reality, if you see it, they are 1/4 the cost. So investors are definitely interested because they see this value that private sector is providing high quality healthcare at very low costs compared to the rest of the world. The problem is we compare within India, but if you go anywhere in the world, I don't think you can find this quality at this price. And I'm saying anywhere. It's not just Europe or US. Go anywhere in the world, you will not find this quality at this price. These qualified doctors, this qualified staff, this high-end equipment, all the outcomes that you see, we have better outcomes than most countries in the world, whatever you can count on. So the investors are interested because of that. The problem is, if you now go to the market, and as all capitalists will tell you that market is the best judge of everything, and unlike us semi-socialists who are still in the romantic mode of providing free healthcare and charitable healthcare to people, if you see the markets, take the top 100 companies of India, you will not find even one healthcare provider. You will find a lot of pharma companies, you will find a lot of laboratories, which are actually connected to the whole ecosystem, but you will not find any hospital or healthcare providers. So we should understand what exactly is going on, where exactly the gaps are. The investors will be very happy if they come in and actually get worth for what is being provided, rather than, as Dr. Somani and Dr. Kapoor mentioned, doctors being labeled as thieves or as extorting people, when actually the cost of service is much higher. The cost of lives, you see the number of healthcare professionals that are falling in this battle, and they're taking their families into the battle with them. So each and everyone in their family is at risk, because we are going to the hospital treating patients. I treat COVID patients myself. I've been posted in COVID duties because one of my physicians, when they fall sick or they go into their quarantine period, I am the Stepney of the organization going around. So I would ask anybody who wants to challenge this cost factor to come and do duties in the wards. What cost are you willing to take? You don't need to be a doctor. Just come in and help us doctors doing the file work, or just talking to patients, or counseling them, or doing some paperwork. it's very easy to say it. How many people have you seen going into COVID wards and actually
volunteering
their work? So there is a lot of things to be taken care of. I think a lot of thoughts to be considered before we start this labeling process of various people.
Right. So, this is a big reason why the IHW Council has come up with the Gratitude Week, because we just take it for granted. We take our good health for granted, and at times when we do fall sick, everybody's to blame. The entire healthcare system is to blame. We never appreciate the good work being done by them and how they help us to lead a healthy life. So this is our attempt to make people notice, but I'm sure this isn't going to happen overnight. So, Dr. Somani, what is your solution to this? How do you increase engagement? Like a lot of marketers say, how do you increase engagement, improve outcomes, meet expectations? Is it just better communications? How do you think the situation improves, Dr. Somani?
I think Dr. Somani is not there.
I think he's got disconnected. So I'll ask you, Dr. Kapoor, same question. What is the way out? How can we improve, perhaps engagement with patients, make them appreciate the hard work being done and the risk to outcomes? You're doing your best, but, this is the risk. So how do you improve that?
One thing more I'll add, Himani, which I forgot to say when I was speaking. That by far, people call doctors thieves, whatever. You talk to any banker, they say that doctors are the best paymasters for all the loans. Doctors are very weak that way. So they will never default on any bank dues. They will never default on any money to owe to the institutions and investors. So that is why investors bank them. And banks also say that doctors are the best paymasters because they have a reputation at stake. You see, that image of a god, and then suddenly, the god becoming a defaulter, just impossible. It doesn't go together. So that at that point of time, they always see that, we are in the right books, we have the right papers, we are always protected. So half the time their life goes in this only, that image to be maintained, what to wear, what not to wear, where to go. Doctor Sahab, you go to a shop, you buy something like an ordinary person, I'm not expected to be there. Doctor Sahab, aap saman khareed rahe? These things of which the public has a different opinion about doctors. They are not human beings. Not running out into a normal human life. But yes, what is important, which was told by Dr. Nagar also just a few minutes back, that engagement in a way that counseling the patient, spending that much time and giving patients to tell the pros and cons, the good and the bad about every illness may improve the relationship to a large role to play. That for God's sake, you have to pay if you get some services. Is all over the world, you travel business class for the same flight, you give, let us say, 1.5, 2 lakh rupees ticket. Somebody is traveling at 30,000 rupees in the same flight. So why you pay business class? So ultimately, there's a cost involved. People must be sensitized that healthcare is not cheap. Healthcare is costly. The drugs are costly. The pharmacy is costly. Everything combines as a treatment. It's not only the doctor who's getting everything out of it, or the hospital getting everything out of it. Connection by way of counseling to the patients, having more counseling centers. I've got a couple of counseling people in every hospital now. So they counsel the patient before treatment. That does make a difference, that this is the cost you have to pay and it may exceed also. So doctors don't have that time. What Dr. Bajaj said is right, that in government setup, who has the time to talk all these things? In private sector, we can afford people, we can afford counselors, we can afford PCCs to connect with the patient, counsel them. And I think 90% of the problems are solved once you counsel the patients properly.
Right. Dr. Bajaj, you were exploring the virtues of insurance. Now, what is the way forward for improved, healthcare coverage by insurance? Because of COVID, a lot of people have started buying insurance because this epidemic has put health in the center of everything. Does this mean that a few years from now, we will have fewer dissatisfied people because they will be not paying out of their pockets and getting better services? Because, like Dr. Kapoor was saying, there may not be an increase in supply having immediately because of these tough 4 months. But like 2 to 5 years from now, does it get better?
So Anisha, see, as I told you, insurance is not the magic bullet at all, and it's not like that people will become more satisfied if they have insurance. See, the incentives of both the doctors and the patients have to be aligned, and the patients have to realize that the doctors are not doing something just for the money or just because they're greedy for something, right? This is what they have to realize. So US has like 90% insurance penetration. Do you think people are satisfied there? It has the highest rates of litigation on doctors. Patients will go and sue you in a minute because of the fact that, again, there is point of exchange of the transaction is at the point of care, and this transaction, we have to realize, is a very imbalanced one. When there is complete opacity in that transaction, the patient feels he has no power on that transaction. So if he comes to you and you say you are having a heart attack, you have to have a stent in, the patient feels, I don't have a choice, what do? I can't take my patient out because he may die on the way. I have to trust you, but I'm not really sure I trust you, but I have no power now. So I just submit to you, but in the back of my mind, I always feel that I may have been cheated because I had no clarity on what was going on. So this problem will remain till the time you make education or healthcare a transactional facility, right? This is why people are dissatisfied with private schools as well. Because they say, oh, the school charges me for this, the school charges me for this, but I have no choice because my child is studying there, so I can't raise my voice, I can't do anything, but still we'll be dissatisfied. We'll still feel in the back of our minds that we are being cheated of something because we don't really know what's going on. So this entire ecosystem has to go on a capitation model or a model where the doctors are paid very well, but not like a per transaction fee. They have to be paid well, right? You can't do that. A doctor will be paid like 50,000 rupees a month and expect him to become a super specialist and study for 20 years. He will obviously run away to brighter futures, to brighter lands. That is why people went to the US and UK in our times earlier, because there was nobody paying them salaries. But now with the private hospital providers coming in, as Dr. Kapoor said, the interventional radiologist, neurologist will be paid 10 lakh rupees a month in his hospital. So obviously he has no incentive to go out to foreign lands. He will provide that high level of care that otherwise he would have went and provided in the Middle East or Europe or US. So you have to be paid well, but try to make a system where you are paid well, but not on a per transaction basis. And the patient also pays a subscription fee and not a per transaction basis. So we see how much the dissatisfaction with mobile service providers went down when we got these subscription models, like a unlimited per month you pay this and you go unlimited. Otherwise, when we were paying per call and per KB of data, we had so many people complaining, so many dissatisfied customers, so many people going to the arbitrators that my bill is unjustified. So if you can make a subscription model for the patients as well as the doctors, that is, I think, the way to go. So when I was in London, there was this big doctors strike. I don't know if you recall that in 2015, when the salaries of doctors had been deducted by the then health minister there, Mr. Hunt. And there was lots of marches and protests, and I joined a couple of them. So we were standing in the tube station with our placards and everything, and every person came to us and congratulated us and wished our best. And we are with you, doctors. We are always with you, and you are our pride. Imagine something of this sort happening in India, where doctors are protesting for a pay hike. Everybody will throw brickbats, and then they say, "You already are thieves. Why do you want more?" That is the difference between paying per transaction and having a system where it is not a transactional thing. So that is the difference between the Western European systems, the Scandinavian systems. You don't see any patient filing suits against them on a daily basis. Do you think they have lesser complications than the US? Not really, right? But the patients trust them more because they feel that whatever they are doing is in good faith, and they say that this is a mistake, not malice. Here, everything will be attributed to malice, not mistake. So
Right. Right. Dr. Somani, what to your mind is an ideal solution for this? We've seen your presentation. You laid it out very clearly, what doctors who then set up their hospitals go through. I wanted to understand from you, Dr. Somani, what to your mind is the best solution for this? How to improve patient satisfaction? Dr. Somani, if you could unmute yourself, we can't hear you.
All right.
Yes.
So there's no clear mantra, Anisha. There's no clear formula that this will work. There's always going to be saying something.
Please go ahead.
Okay. So there's no clear mantra. We just need to have a very clear understanding and put things together that the understanding at the level of people. That's the first thing. That what private healthcare or public healthcare, where is the gap? What's the analysis? What we should do? What is our understanding? Understanding at the level of government, understanding at the level of media, understanding at the level of fellow doctors, understanding at the level of insurance companies also. And there's a lot of talk regarding Ayushman, CGHS, insurance. But then there is another gap that sometimes some of these the appropriate rates are not there for anybody to understand how private healthcare would run on the said rate lists or anything. So there's no clear mantra that okay, do this and this will solve. That's not going to happen. It's only going to happen, and it's going to see a real change when we see that there is a very clear shift in understanding of everyone at every level. Otherwise, we've been talking this. I have been to various forums, and we keep talking, and we keep talking, and that's how we vent it out. But it doesn't translate into any change really. So if you want to change a shift, I think it's going to take some time. But
yes, but at least we're making a start here, Dr. Somani. We want to thank our doctors, our healthcare staff. They're doing an exemplary job. This pandemic has brought forward to the center stage the efforts being made by healthcare staff. So I'm sure now people will certainly be a little more grateful for what doctors are going through, and not just keep criticizing them for everything that doesn't meet their expectations. This is our hope, and this is our initiative to see that there is more gratitude and there is more thanks, more bouquets and brickbats for those running hospitals. Thank you so much, Dr. Kapoor, Dr. Bajaj, Dr. Somani, for speaking with us, sharing with us your views on the challenges hospitals face when just doing their normal day-to-day jobs. Thank you so much for joining us.